Trauma, you better be thinking over here because they're struggling a little bit. Trauma, you want to try to steal? So what is an extraperitoneal bladder injury? Bladder injuries can be intraperitoneal, meaning it's like you had a full bladder and your bladder ruptures. That has to be repaired. Or if it's extraperitoneal, so the pelvic fracture actually scratches or tears the bladder. Those generally don't have to be repaired. They'll heal on their own. You just have to keep the bladder decompressed with a Foley and a suprapubic catheter until that happens. Where are we back on trauma side? Okay, thank you, Cray Ray. Category amount? Just so you know, we got another whole board. So we're gonna, you know, we got plenty. This ASIA score represents an injury with sensory preservation, but motor loss below the injury. So you've got an acute spinal cord injury, and the patient can feel, but can't move below the lesion.
Spinal shock?
Not correct. Shock, you guys got any idea over here?
Say 5. 3? Okay. We're going to say, what is 5?
What is an ASIA score incomplete B? Usually for this thing, this needs to be done by your physical therapist or the neuro nurse practitioner, because this is very detailed. It wouldn't be a rapid primary or secondary survey. But that was a good, I like that. I like picking a number like 5. That's, give it a good old college try.
A lot of rehab uses to determine which level of spinal cord rehab they need. So it's really important, and they go from like an A, B, or C to show their progression of the spinal cord.
Yeah.
All right.
Shock, we back over here with you?
Okay, wild card 300.
You're thinking, next time we're going to make sure we got a ringer of each group. We need a neuro nurse, we need a burn nurse. With the onset of multiple new anticoagulations, this point of care lab test can yield results to guide reversal. The outgoing president of AACN, Christine Schulman, was an expert in this. She did an outstanding presentation a couple years ago in Jacksonville.
A lot of places can't do it at the point of care. They send it to the lab.
Y'all agree INR? What is INR?
Oh, the team doesn't agree.
Okay. What do y'all think?
And this is becoming a huge problem in the country because everybody is on some kind of these designer drugs, and they're not reversible. I mean, when you took the old rat poison Coumadin, at least you knew the reversal. You got to just pump in the FFP until you fix the clotting disorder. But now you've got 9 steps on a clotting cascade, and all these designer drugs work at a different level. Trauma, you got a plan over here? You got a...
ACT machine?
No. It's the TAG. TAG is the one where you actually have the blood goes in a little space, and the little post goes back and forth, and it actually tells you where on the 9 steps, the clotting cascade, it's been interrupted, and it can guide your therapy, and it gives you these neat little curves. So if you don't know that, that's one you can study up for pretty easily. Just Google TAG. Not now with your phone, but when we're done here.
And this is becoming in the new literature, this is the new way to resuscitate. No longer is it 1-to-1 or 2-to-1. It's now patient-based with following the TAG. And you're following the trend of this curve. And then you can decide based off of that, they need FFP, red cells, fluid, things like that.
Disclaimer. We were just thinking about that new case intro stuff?
Yes.
It's based on the INR.
So the problem with Kcentra is that that's a reversal agent, but it's also, talk about drug shortages, it's a drug shortage now too, because no one can get it. But yeah, most people would give it as a drug, but it's a drug, it's not a lab test.
Yeah, no,
So you were thinking of the INR with the Kcentra?
Yeah.
Well, locally around here, we use the TEG scan mainly for our surgery patients like intra.
Yeah.
I don't think it's used.
It's not as common, it's becoming now, it's been used in open heart for years and years, actually. And just now, trauma's kind of catching on. And shock trauma, they've been doing it since I was there, so that was like 5 years ago. But a lot of the other trauma centers are just starting to now use it. And now they're actually doing it as a point of care, where you roll into the bay and then you can get this. There's some practices, I think Indiana is the hospital that has, where you can actually get it on your phone real time. You run it right there in the bay and then you get the tag right there on your phone.
Yeah, and it's just so you know, logistically, in a busy trauma center, just getting the machine delivered and then having your charge nurse not send the table it needs to sit on, because the test is only accurate if you have an excellent table, because it's going like this. So if the table's wobbling, your results don't mean anything. So that was one of my last responsibilities. Gerald, did you have a question or comment?
What does TED stand for?
I'm having a blonde moment.
Of course you're gonna have something graph. It's something graph. But it
I'll have to-
specifically breaks down your blood to look at how much you have as FFP, how much clotting factor do you have, how much red cells do you have. We're going to put the
Yeah, it tells you where the blood, where it tells you where in the clotting cascade the blood's breaking down. So think about an elastic band and where it's snapping, and then based on where it's snapping. So it's goal-directed therapy. The therapy is based exactly on the patient's problem. So it's a pretty cool thing. As an educator, I'm a little old-fashioned. It makes it great, like bulletin board, like little pictures and stuff. No, it does. It's one of those things when you're eating your lunch, you can read it, about 15 slides, and say, well, this means this means that. It's pretty easy.
Because I don't have time to read all that. I don't want to know what all those numbers are. I don't need to memorize more numbers to remember what. So it's literally a picture of like weight. Anyway, it's pretty cool.
Where are we? Okay, right. Yeah, think trauma. Category them out. This lab test should be obtained on all pregnant trauma patients to detect whether a transplacental hemorrhage has occurred. So that means fetal blood has leaked into maternal circulation. That's not correct, but it's part of the fact. It's no.
Specifically about fetal, not maternal. Maternal is the RH. Like the screen is maternal, but it's the fetal.
Shock, come on, start thinking, because you can steal here. You go ahead and steal. Okay, Kleinhauer Becky, yes, excellent job. Somebody's read that chapter. So it's a very specific lab test that looks for fetal blood cells, little tiny fetal blood cells in maternal blood. So you're going to take some of the months left, and it goes to the lab, and it quantifies how much baby blood has bled into mother's blood. The RH factor comes in because it is the test done after an RH positive baby is born to an RH negative mother, because then based on that KB result, you calculate ROGAM. So that's the second half of it. Do we want to go ahead and go into double Jeopardy, some new categories? Let's go ahead and do that. I'm not sure how we can do that, but I think we can real quickly. Give you some new categories, give you some new numbers. Okay, so we got a whole set of new questions and new categories. We did enough of that stuff. You want to read those categories?
So, continuum of care and prevention, shock, spurs, and mods, registry and professional, extreme of age, and wild card.
So just so you know, K-Ray and I were talking earlier about some of this stuff. If you're clinically active at the bedside, you're going to find the clinical questions very, very easy to know. You know your stuff. You're good at it. That's why you do what you do. But if you're not a trauma program manager or quality assurance, some of these categories are where I had to spend more of my time studying, just so you know. And whose turn is it? Yeah. They stole it, so it's their turn again. Yeah. Category and amount. Some of these are easy.
400.
This marker of shock indicates the amount of base needed to titrate whole blood to a normal pH. Can I give him a hint? No. She's tough. She's tough. Yeah.
What is base cell?
Go ahead and bring the answer up. I think they've got it. Good job. So now with pulse oximetry and finger sticks, but an arterial blood gas, the number you never looked at when you learned arterial blood gases. You learn pH, then you learn CO2 and oxygen O2 and O2 sat, but it is the amount of base you have to get a normal pH. That's a great answer. Good job. Trauma? Pick up, come on.
600?
Cytokines and chemokines cause a severe physiologic reaction in this precursor to sepsis.
What is Sears?
I say it loud so your captain can tell us.
SIRS.
Yeah, right. What is SIRS, which is Systemic Inflammatory Response Syndrome. I know that one. Thank you very much, Gerald. Okay.
And there is sepsis on the TCRN, but it's very small amount. It's the basic sepsis shock stuff. No cardiogenic stuff. I don't like cardio.
Trauma, pick a category and amount.
No sepsis.
Oh, them again? I'm sorry.
Shock, 800.
My favorite. I love this.
Two presentation patterns. Rapid single phase from massive injury and soft tissue damage, or delayed as a result of moderate injury and shock. There's only, you do have to figure there's 60 times 60, that's 120 questions. I don't know if I'll know if I got the right answer or not. You want to let trauma sign?
We're gonna try.
Yeah, okay. Okay.
So, what is Roundup?
No. So you have, I'm not going to give me clues. I'm being good.
She likes to help everyone cheat. She'll give everyone the answer. You want to give them a chance?
Yeah, go ahead. Trauma, you got a chance? Let's go. I want to get sorted through a few more questions. So, question? No? What is MODS, or multiple organ dysfunction? So, one way or the other, you haven't adequately resuscitated the patient, either acutely or over a longer period of time. You haven't normalized their lactate. So, if they're greater than 24 before you get them normalized, probability of survival goes down. Alrighty. Trauma, category and amount.
600? I know it's hard to read it.
The Emergency Medical Treatment and Active Labor Act, EMTLA, is part of this law. I think that's correct, is it not? I think we're going to see either way. Go ahead. I think it's right. Yes. What is the Consolidated Omnibus Document? We talked about that a little bit this morning in the very beginning at 8 o'clock about how the transfer of patients inappropriately, we had to stop that. You know, we couldn't be moving trauma patients around because you didn't want to care for them. Nice job. Nice job. Where are we? Okay. Shocked. Just by the way, if any of you want these questions in this template, all you have to do is email myself or K-Ray, and we'll give you our L. Gerber SMI at AOL, and we'll send you the whole presentation. Because what we want is more TCRN certified nurses in trauma centers. We want to set a standard. And you can.
You're already the best. Just prove you're the best with the certifications of it. That's what it does. We know we're the best. Let's just have the certification to say that.
I had never had a certification because I didn't feel like I'd only worked in shock trauma. I took care of trauma patients. I wasn't an emergency room nurse. I wasn't critical care. All I knew was resuscitation. That was my specialty. When this exam came out and I took it, I was like so proud. And you have to see me at conferences right after I got the certification. I had like a little marker. I was like changing all my name tags.
I put it on everything. It's not like everything at work.
Okay, what's that?
Professional.
We'll do QM $1,000.
Ooh, bragging rights, they're going for it. Multidisciplinary, data-driven, used to identify opportunities for improvement and measure outcomes. Quickly now. Have confidence in your answers.
What is performance improvement?
Exactly. Oh, you're killing me over here. I'm like, I hear something like 5 people go, PI. That's right. So it's looking at your system, where are you working, how can you improve? It goes across the continuum. Come on, trauma, you got to pick a high one too.
Continuum of care, shock, response, extreme of age, wild card. They all come down.
This allows for a trauma center to benchmark itself against centers of similar capabilities. I think that's it. Is that right? What is the, well, I think that it's, what is the National Trauma Bank? But that would be the trauma registry. That's why good data in, you can benchmark yourself. So we're going to give them that one because I think they understood the concept. Because it's going to be a multiple choice. You're going to have A, B, C, and D. It's not a fill in the blank. I don't think there's anything you have to. No. You can't take anything in, not a stick of gun, not a Kleenex. They'll give you a Kleenex if you need it. They won't let you take a piece of hard candy in wrapped. You got to unwrap it. They do give you a little grease board with a marker. So if it's stuff like the Bern formula or Glasgow Coma scale, if you're something you've memorized, but as soon as you get in there, you can, anything you've memorized, you can write on your little grease board. Just little tips. Not that I have testing anxiety or anything like that. Where were we?
She doesn't want to be responsible for choosing the wrong question.
can be caused by a tension pneumothorax or a